staff. I will be reading the list of volunteers and bus drivers.
All right, coaching supplements, Ms. Knight.
Per request of board member Mott, she asked for a list of the coaching supplements, and you will have that, you'll find that in your packets.
Okay. School handbooks, Ms. Knight.
Yes, so I have 2 out of 3 principals here, and Ms. Hooper, would you like to just share you all the copy of the school handbooks? You should have another copy in your folder today, and I don't think there's very many changes, but Ms. Hooper.
Yes, there's not a lot of changes other than updating dates and the pesticide schedule for the football fields and things like that. The one change that we did make to the discipline policies is on page 9. If you look through that, and it's in the class 2 offenses, and it's misuse or improper possession of medicine. This is outlined in the nurse's part of the handbook, where children are not supposed to have over-the-counter medicines or different things like that on their person. But last year, even with multiple warnings and discussions with students and parents, we still had students that were insistent on bringing and carrying these on their person with like the Sam's Club bottle of Tylenol, where they could have really taken extraordinarily too much medicine, without anybody being able to supervise. So we added the misuse or improper possession of medicine in our discipline policy, and just keep in mind we put that there. The first time we're going to have just a conversation with the parent and with the child, but this is if someone continues to be persistent, then we felt like that was something that needed to be added, and we put it under the class 2 offenses.
What page is that?
Page 9. At the top of the page says administration disciplinary measures grades K through 5.
You changed that at the very beginning of the year, right?
Right, okay, right. So that was really the major addition for us this year, and just updating everything else. And I'm sorry, I just freeze to death in my office, and so I threw on my summertime get up, and then it's like, oh yeah, today's the board meeting, so, yeah.
Thank you, Barbara.
Thank you.
Ms. Walsh.
Ms. Mott, can I borrow your copy of
Actually, I didn't have one for the next one.
We had very few changes also. Mr. Mellis took care of most of our changes for us, and I think
Probably got the high school.
I got the high school. I was like, that don't look familiar. So,
I'm sorry to interrupt, Ms. Walsh. I have Ms. Reeves and Ms. Buchanan down at the bottom going through stuff for our new classrooms. If you don't need me anymore, is it okay if I go to help them inventory?
Yes, ma'am.
Thank you so much.
Be sure and hold your coolers.
Yes, I will. I put salsa last night.
did you dance or I went to get my car last night, and my sister-in-law with me. 5-gallon bucket of beans strung and broken. So I had to go home and do beans with our volunteer. We made very few changes except just updating personnel and staff. And we did also add a clause in there, and I don't remember what page it's on, but it was about COVID and how, things could change based on COVID. And it was just a general statement. But other than that, we made no changes.
Any questions, Ms. Walsh? Thank you, Ms. Walsh. Appreciate it. Mr. Matheson, you're on, sir. You just walked in. That's good. I don't have a copy of my book either. You're a good kid.
Mr. Garland, I'll give it to you.
Check me.
Sorry, no, never mind. I just got too much stuff. Just put me in here with.
So our handbook is virtually the same as it was a year and a half ago. The only real change, I think, that we've lightened up the dress code just slightly. It's like last year, during COVID, we allowed the boys to wear caps in the building. We hadn't done that in the past, and we are continuing to do that. But other than that, our handbook is virtually identical to what it was 2 years ago.
Did you say you're going down to?
We are going to allow them to wear caps in the building. Yeah. It just got to the point where it's not a big deal. No, it's not. So, does anybody have any questions about it, where you've looked at something?
Okay, technology acceptable use policy, Ms. Waldron.
Yes. Just bringing it to you to reaffirm again this year, there's no changes, everything stays the same. So we hopefully won't have to have a second reading. Ella also talked to you about it real quick, when she does her policy stuff. So other than that, everything's going good. It's very, very busy. 2 weeks is not much time to get ready for the teachers to come back. And we're just extremely busy. E-rate was approved. So our equipment for all the access points and the networking stuff, the E-rate should be coming in. I was hoping in September, but it's looking more like it will start rolling in December, November or December. And then we'll get really busy with inventorying, setting up, and hopefully installing. I am going to put in applications. I don't know if you've heard of the emergency relief funds, and that's also for the E-rate system. I'm going to put in applications for that this afternoon, hopefully to get some hotspots. See, last year the hotspots were provided by the state, and the Methodist Church also bought and donated hotspots. Hopefully we'll get hotspots and more Chromebooks through this, but it'll be a while before I find out about that. Other than that, everything seems to be going really good. Like I said, it's very busy. So, if you have any questions about the acceptable use policy,
All staff and students sign this.
yes, all staff and students have to sign it every year. So they know about it. It's on the website. There's links to it. And yeah, they have to sign it.
Sign it in your computer, it's there, same thing.
It's there. Yeah. And that, it's a policy and have to have it in place. But like I said, nothing's changed in it. Everything's still covered with it, so. And if we need to make changes in the middle of the year, then we'll come back and do that. They sit with comply and all that kind of stuff.
Anyone have any questions, Ms. Waldron? All right, thank you, Ms. Waldron. Okay, we need to vote on it, okay. Do I have a motion? Okay. Do I have a motion to accept Ms. Waldron's technology acceptable use policy? Approved. Do I have a second? Second. All in favor? Any opposed? The school handbooks, we need to vote on that. Do I have a motion to approve the school handbooks for 2021-22?
So moved.
Do I have a second? Second. All in favor? Any opposed? Okay. Mr. White, construction progress update, and I hope it's good.
Partially.
That's me, sorry.
Well, good morning, all. There was a construction meeting held on July the 27th, so last week. I'm going to kind of break my update into two parts. I guess I'll go with the renovations and then new construction. So as far as the renovations are going, it's nearly complete. I would invite any of the board member to go down and take a look. It looks really good. The flooring was scheduled to be going down today.
And they're putting floor down.
And so they are there putting the flooring down today. Now, there will be some doors that are going to be coming in a little bit later than was anticipated, but there will be some temporary measures taken for that situation.
They have put in temporary doors. They have put in some temporary
So
doors.
they've already taken those actions. So, but the renovations have went very smooth. Of course, a few material delays such as that, but the renovations went really well. Now, as far as new construction goes, there have been some pretty major delays. As any of you that went out to try to buy any type of building materials or anything like that knows, this is just a time during this COVID time, it's hard. So they've had some major delays in getting the storm drain materials. This delay is now at 60 days. And so with that in mind, we have, Ms. and I did sign a contract extension that now puts the completion date at June the 3rd. Of course, this extension was due to the material delays. During our meeting, we did discuss some future things that we're looking at. The next thing is roof insulation. They discussed, some of the other projects that's going on around the area that they're having difficulties getting the roof insulation in on time. According to the suppliers, the materials for the roofing should be available by November. And now, according to all involved in that meeting the other day, that date works fine with our itinerary. So with our schedule, as long as we get the stuff by November, it shouldn't put us back any longer. So, engineers were here last week. Basically, what we were looking to do was try to figure out exactly the precise locations and the depths of the French drains that's going to have to go in. And so from my understanding, they were here last week. And so hopefully we will get those results sometime this week to find out exactly where to place or the precise locations for the drains themselves. So, but again, I invite any of you guys to go down and take a look. I think Ms. Walsh would agree with me that I think things look really good down there. And it's coming along, and especially the renovations are coming along very well. Any questions for me?
You said the wing won't be done until next June 22.
So the first day that we looked at was.
Then my next question is for Ms. Walsh. Will we have enough room for our 6th graders?
Yes, we have enough room for this year for everybody. We are still able to use some classrooms that will eventually be turned over to the high school.
Right.
So we are good for this year. We pretty much have everybody assigned a room, and we've started moving some of the teachers in that are coming from the middle school.
Right.
They're there today doing some touch-up paint. They are starting to put down flooring, and then they will set the appliances and everything. They put in temporary doors because we may not have doors till mid-September. And they've made a lot of progress out back on the new part since we met last week. And one thing, once they are able to put in the footers, which from what I understand, concrete's pretty hard to get right now too. But once they put in the footers, Western Builders really took a chance, and they had pre-ordered all of the steel in hopes that they would get the contract and they put it in storage. And so we won't have to wait for the steel beams or any of that. So once they pull the footers, that part should go pretty fast.
Okay. Had they not done that, we would be looking at probably a December 22 finish date. So.
Okay.
Are we we're gonna be ready to get them in?
We are. We're going to be ready to get everybody in.
I missed the last meeting, so I had to go to the office.
Yes. The only thing, we will have our orientation on August 12th. And I have told my staff that we're not going to let parents come down the hall on August 12th because I don't want my staff to feel rushed to make sure everything's fixed. And also, once they get the flooring down, then the custodians will have to wax. So, it may take the rest of that week and even the weekend. And so I said, Ms. Knight and I have talked about it, and we will, either have a night that parents can come in if they would like to see the renovations, or we will do a virtual tour also so they can see everything. But I just don't want to rush everything and have have it halfway the way we want it to be.
Thank you, Mr. White and Ms. Walsh. Ms. Cable, Title I Parent Involvement, Family Engagement Policies.
Yes, I brought for you in your package, you should have a Title I Parent and Family Engagement packet, and also one that says parental involvement. We are to bring this before the board every year. Nothing has changed about policy. This is part of the ESSA requirements for Title I schools. Basically just outlining our dedication to cooperative partnership with parents, asking them in and including them in their child's learning and what that looks like as far as having them volunteer, offering training, and keep them abreast of how their children are doing and progressing throughout the year. But nothing has changed from the previous year, from last year. I just have to have this voted on again for policy. Any questions?
Have any questions? No. Do I have a motion to approve the Title I Parent Involvement, Family Engagement Policies as presented by Ms. King? Second. Do I have a second? Second. All in favor? Any opposed? Okay. All right, fiscal year 23, weather-related calendar waiver request.
And I will note that Ms. Knott asked to circle back to her request for coaching supplements. Actually, her request, and I overlooked part of it, was for anyone that had any additional duties, any supplements, and so Ms. Knott, we will work on getting that.
But I just didn't want to think I was targeting coaches.
Yeah, absolutely. So we'll circle back and we'll get that to you.
Thank you.
As well, or Jay on as well. Fiscal year 23 weather-related calendar waiver request. Each year this comes to you, you have it in your packet. Due to, well, COVID year was a little different, but due to most years when we miss at least 8 days in the calendar year, over a period of 10 years, if we miss at least 4 of those 10 years, 8 days in 4 out of the 10 years, then we are eligible for a calendar waiver request. And really what that amounts to is we can start school a week earlier in other systems based on our weather issues. And so this coming for the 22-23, we have one this year already. This is looking at next year already, 22-23, because now we're this year, we're already planning next year. And so it's just for you to approve that we can start early. And we typically try to do this in as much of our first semester in the high school as we can, so that we can get before Christmas, so we can get the test completed before Christmas if possible, and that way it also aligns better with community college schedules for our students that will be taking community college classes. So I would request that you consider approving that waiver.
Do I have a motion to approve the LEA-based calendar waiver request for weather-related causes for the school year 2022-23? Do I have a second? Second. All in favor? Any opposed? Okay. Donation to the wrestling program.
Yes.
Tonight.
So I would like to officially request your approval to accept a $40,000 donation that was made to the wrestling program. The donation was made by Sandra Marion Elise Helms in honor of her parents, Frank Ernest Elise and Frances Broom Elise, and the donation was, the purpose of the donation was for new wrestling mats. So,
I can't remember all that. Do I have a motion to approve the $40,000 donation to the wrestling program by Sam and Marion Elise Helms in honor of her parents, Frank Ernest Elise and Frances Broom Elise? Do I have a second? Second. All in favor? Any opposed? Okay, we talked about this last meeting. The memorandum of agreement between the Eastern Band of Cherokee Indians and Graham County Schools. Ms. Knight?
Yes, and this is an annual memorandum that you look at each year. We did revamp this somewhat this year, just to include the language position that we discussed at the last board meeting and the supervision chain of that. Myself, Mr. Moody, B.J. Robinson that presented at the last meeting, and Zena Rattler, who was the chair of the Indian Parent Committee, met, and we discussed changes, and we were all very happy with those. And the alignment, that's what you have in front of you. Really, the only changes were adding that additional language position, and all those positions will be supervised through Ned Long, who is their on-site supervisor.
So we vote this one too.
Yes, I
We
will.
have to agree.
Appreciate it.
All right, do I have a motion to approve the memorandum of agreement between the ECBI and GCS? Do I have a second? All in favor? Any opposed? Okay. J, COVID impact community update. Ms. Booth, come in.
Hi, how are you guys doing?
Good.
I brought Maria with me. She can give you a little, probably more of a clinical update than I can. As far as for the community, we are in the red. We're one of the red counties. Pretty much everybody in the west is red at this point. We're looking at a pretty high viral spread of the Delta variant. As far as the spread across unvaccinated and vaccinated, we are seeing breakthrough cases. They are lesser than our unvaccinated folks. And we're not seeing the severity of the disease in our vaccinated versus our unvaccinated folks, but they are crossing over. So we are having some breakthrough cases. Angie and I have sat down on the Strong Schools Toolkit. We have also gone over kind of preliminary planning for when school restarts, what it's going to look like. I am available on an advisory capacity to tell you guys information, whatever you need to know to make those decisions. The DHHS has left it up to the individual counties and the school boards. So whatever you guys decide, we'll be happy to support you and give you guidance and walk you through the process and that kind of thing. But like I said, Angie and I have worked out kind of a preliminary on this.
This is the governor's.
Yeah.
This is the governor's
Together. Yep.
and we speak about every day concerning.
So we are working out kind of what this is going to look like for us. But I'm here simply to advise you of what the state has told me as far as school restarting. Sure, Angie's probably filled you in on most of it.
Well, actually, you were.
Okay, so I didn't want to overstep, so you correct me if I'm wrong. So what you're looking at, it has been left up to the individual counties what you guys decide to do. The recommendation is to mask regardless of vaccine status, K through 12 and staff. That is the recommendation from the DPH. But it is up to the county what you want to do. So, what it's looking like with the quarantine, isolation, classrooms, that kind of thing, if the children and the teacher are masked or masked, in other words, the entire classroom is masked, a child tests positive for COVID, the classroom does not have to quarantine. That's one of the biggest advantages in masking. So, if you have chosen to go optional with the masks, the child tests positive. Anyone in that classroom unvaccinated has to quarantine. So the only stipulations to not quarantining are if you had COVID in the last 90 days, you're vaccinated, or you're masked or masked. Under those three circumstances, the entire classroom does not have to quarantine. The recommendation is for them to quarantine for the 14 days, just like it was last school year. So, again, that's a local decision. So, those are the recommendations as they stand from the state.
I know other counties have decided to go mask optional, but then leave it up to the school board to revoke or change that decision. Fully in support of whatever you guys decide to do, and I'll walk through the process with you. You guys just let me know.
And I will say that we're working on a partnership with an additional, school nurse
Yes,
that would just be in charge of any kind of COVID tracing and helping us, work with any of the COVID related things that we're doing.
yes. So, and you filled out a survey at the end of June, no, end of July, that opted in. And what that is there will be a vendor coming into the school itself to offer testing. And that can be routine testing, so in other words, screening testing. So if a classroom, somebody tests positive and you want to screen the entire classroom, the vendor will be available to do that. If you have a kid that is symptomatic, the vendor will be available to test them as well.
With the parent permission.
With parent permission. So that's the caveat is, I don't know, again, how you guys want to do that. If you want to blanket the school with the permission form, if you want to go classroom by classroom, however you decide to do that, totally up to you. But the vendor will be available to do routine screenings in the school.
And I want to be real clear with what Ms. Smith is saying. Being available and being mandatory is two different things.
Yes, it's totally voluntary. So that's the reason for the
It's a
parent
service for
permission.
those who choose to.
Absolutely. So it will be available, and that was part of the opt-in, is it's not mandatory, but we wanted to at least have it as an option in the school, so that way we won't have to worry about sending them to urgent care or wherever to be tested. It will be available, so it releases that barrier of parental issues with either travel or transportation or availability in general.
And hopefully less spread of vaccine.
Absolutely, and it is all funded by the state. So the state pays for the personnel and the state pays for the supply. So it's totally no cost to the staff or the students.
Can you give us some kind of idea of the numbers that are testing positive now? Just, I know you probably can't give me,
It's been averaging around 6 positive cases a day for some time.
okay,
Yeah.
for some time.
Yeah, at least probably a month.
Yeah, at least a month.
So we're looking
We
at around 180, 190 cases.
We are actually above where we were this time last year as far as positivity rate. The week of July 25th, 26th, we were over 10% positivity rate.
Now, are any of these kids that are like 12 years old or younger?
We have had a few. We have.
Okay.
And it seems that the Delta variant is more communicable with everyone, but especially with children. There has been an increase in children with that strain.
I personally, and you can comment on this if you want to, if you don't feel comfortable, but I personally feel that children are not vectors of this virus. I don't know how you feel about it, but it sounds like we are saying that we are striking a balance between, it's what sounds like personal responsibility, working with you guys, and especially individual freedom. But if you can comment, if you think, but I personally don't think children are vectors of virus. So.
And that's fine. That's just your personal opinion. We have seen more spread in children with this particular variant than we did, like she said, last time this year, or last year this time. So we are seeing the spread in children. The biggest thing is the Delta variant didn't become an issue till the end of June. So it was not an issue last school year. So, like I said, when we entered this school year, Angie and I have been going back and forth pretty much on a daily, because we'll be really interested to see how this plays out. I know in Raleigh, one of the year-round school districts made it a week and then ended up shutting down. So, and they were mask on mask. So I'm not sure what this is going to look like. I'm not going to say that I have any projection as to what this is going to look like. And so
like you said, I am just here to share balance with you guys and help you the best we can as we step through this. And you know, I took it day by day last school year. Every day was a new day for us, and we made it quite a while. So that seemed to work well.
Remember last year when we closed down for the 3 weeks, it wasn't because we had so much spread, it's because we didn't have enough warm bodies to supervise children, because we had very few subs, and a lot of our substitutes, you know, were older and less, you know, likely to want to be in the schools at the time, because remember there were no vaccines available at the time. And then, so we just really didn't have the personnel in place to keep school going when you have so many people out. That scenario may or may not change this year. And so, you know, we may have to take it, like you said, we do a day to day, but, you know, we maintained very well last year with, I feel like, very few people home.
Yeah, I mean, it was considering I thought last school year was great. So, you know, I'm very much open to kind of taking the same procedures going into this school year, but just kind of, we'll play it by ear, see how it goes. Every day is a new day, and we'll adjust accordingly. We have been working pretty closely with casinos. They are going to bring their mobile unit to the 8th grade orientation and the 9th grade orientation.
And also to the elementary.
And also to the elementary. So that way they'll be available. Again, it'll be just in the parking lot, totally mobile. People are welcome to take part, or they don't have to. That's totally up to them, but we did want to make sure that it was available at those gatherings, so that way, if again, transportation has been a barrier for those folks, they're welcome to get it then, and the casinos will come back to the schools 4 weeks later to give the second dose if they've opted in for one of those vaccines. They have all three. They have Pfizer for our 12 and over. They have the Johnson & Johnson, and they have the Moderna. So it's totally up to whatever that person wants.
So anybody 11 and under cannot get the vaccine?
Not yet. Pfizer is under testing for up to 2 years old, or down to 2 years old, I guess would be the better way to say that. They're hoping for approval down to 2 sometime this fall. And Pfizer is also up for full FDA approval, not emergency approval. So that is all hoping to transpire this fall.
Well, I've been vaccinated, I have to have a COVID test. So if someone comes to the health department with non-COVID symptoms and they're sick, do you give them a flu test?
We do not do the flu test in the health department. We do COVID testing, but we do not do the flu test. We refer to urgent care. Urgent care and Tallulah do flu testing. We see all of their lab results. They send them to us. We've gotten a lot of questions about where his flu went with all this. Well, flu is really decreased because of the masking, because of the social distancing, and because of people staying away from large gatherings. People are being tested for flu. We have saw many negative tests. Urgent care generally tests when they test for COVID. They test for flu also. The clinic does based on your symptoms. So it's not like flu has went away. From everything that we see from the testing that we receive and from the data from the state and nationally, the measures that have been done with the masking, the social distancing, the hand washing, avoiding loud crowds, has really decreased flu cases. It really has. So, but we do see just about everyone is tested for COVID, not all, but just about everyone at urgent care especially is also tested for flu. And we saw very few cases that were positive. We have unfortunately, some people that tested positive for COVID and for flu at the same time, and that's horrible.
Well, and maybe once we get back from vacations and back into our community, maybe things will get a little bit less. I don't know, because if you're going to places that are hot spots, and, you know, I say it.
We've had quite a few tourists here too. And do you think they've had an impact on any of this rise in the COVID?
What mostly we have seen is from community gatherings. The Delta variant by the research is looking, the other strains, they were about one infected person to 2 people. The Delta variant is looking about one infected person to up to 6 people. So it's not, the data is too early to show if it is more deadly than the other strains, but it is showing that it is more contagious than the other strains. So what with the other ones, 6 feet, 15 minutes, you should be good to go. This one, they're not so much sure on even that length of time. What they call the viral load, so the amount of virus you have to breathe in with the Delta variant is lower. That's what makes it more contagious. So with your tourists, it really depends on what they're doing. If they're just here to grab a quick meal, probably not. If they're just in and out of Ingles because they're riding the dragon, probably not. If they're participating in the outdoor activities, probably not. If they're spending more time here, you're going to see probably an increase in that, especially if they take part in any of the gatherings amongst community members. That's when you're going to run a little bit more of the risk. Right?
But it's probably here to stay, correct?
Oh, yeah.
And so there's a possibility with all the variants, we could go through the entire Greek alphabet before we get through this.
Yes.
Right?
Yes, that's the reason we have really, at the health department, sort of tried to start striking a balance, not only with you guys, but just with the community in general. We're getting ready to put out a survey regarding the vaccine. What is the concern with the vaccine? What do you feel like could make it more palatable as far as the vaccine? What do you see as wrong? What do you see as right? From my just professional perspective, are there downsides to the vaccine? Probably. But my analytical mind says you're more likely to die from COVID than you are from that vaccine. So is that a risk you want to take? That's your personal choice. Absolutely all day long. But you are probably more likely to die from the virus itself than you are from the vaccine. Those are the statistics that you're looking at. So, and that's what it really comes down to. But we really have just tried to meet people where they're at with the virus and with the vaccine. So again, we will support you whatever you decide to do. And we will support the school system no matter what they decide to do. And we'll walk through it together. So whatever you want to do is great with us, and we'll just figure it out.
Mr. Moody has a question.
I dealt with the coding members for the school last year in quarantine. And I don't know anything about the Delta, but what really got us last year was the quarantine swap. Again, shut us down was the problem. And again, speaking from what I know, almost everyone that we quarantined did not get it. Okay, now that could change. So with this new person coming on that could do the testing for us, is the parameter still the same as far as when we put somebody in quarantine? Do they still, we wait 5 days to test them and then they come back, or do they still have to wait 14 days, 10 days before they come back? What's the protocol now?
Testing is recommended 3 to 5 days after their day of last exposure. The individual who quarantine is positive up to day 14 and somehow beyond. So you can shorten the isolation period for someone that's tested positive, but quarantine, if you really want to control COVID, is to quarantine for the full 14 days.
And again, that's a recommendation.
And that is a recommendation, but it has been proven to be effective.
Because last year we ended up doing 3 to 5 days, testing and bringing them back. So like I said, I don't know anything about the Delta.
Because they were critical staff.
So,
Right.
They were essential staff, and we did it.
because I think we did that for kids too, if I'm not mistaken,
I think we might have put that.
towards the end. So that's what I'm asking, if that's protocol that was followed.
Yeah, I mean, the quarantine is still recommended every 14 days. So again, that's kind of up to the school system. You didn't have the option of testing inside the school system last year. That may make a change to your decision. And also remote learning was an option last year and it's not this year. So you are looking at a completely different set of parameters, a more infectious virus, but no remote learning and the option of testing inside the school. So,
Explain the quick test versus the long test to me. I'm still confused on
The
that.
rapid test, any
Rapid test.
of the COVID testing is only as effective as the collection process. So if you do not go far enough into the nose to get a good specimen, you may have a false negative test. The PCR cultures out, that's the long test. That takes a couple of days. It cultures out, so it will be able to pick up, that test can pick up what the rapid may miss. We have found the rapid test to be very, very reliable. And at this point, between health department staff doing it, urgent care and Tallulah, their technique is great.
I've been doing it a long
Yeah,
time.
they've been doing it a lot. The PCR test is recommended, the long test is recommended, say I show up at urgent care and I've either had an exposure, I'm in a household with someone that's tested positive, and I'm having symptoms, and my rapid test shows negative. The guidelines, the protocol is they do a PCR test to ensure, and a few times they have called a positive that was negative on the rapid, just because it had longer to culture out. And it's a more reliable test.
I do have a question. For the people that do choose to take the vaccine, I had a friend that did not take it. The guy that took the vaccine was worse than the guy that did not. Do you know why?
The vaccine.
No, go ahead.
The COVID vaccine is like all other vaccines. It works as well as your immune system works. So if you have comorbidities like myself, I'm overweight, I have asthma, I have high blood pressure, I have kidney disease, and I'm over 50. So the vaccine for me may not be as effective as it would be for a 21-year-old healthy individual. So I know that I need to continue to do all those precautions. I'm going to get some benefit from the vaccine, but no vaccine is 100% effective. Probably rabies vaccine is the most effective that we have.
Well, these two guys is roughly the same age and about the same size.
Yeah,
Yeah, so it's just depends on your immune system.
how well your immune system, and that's why children normally do so well with illness. I feel like I'm right on your back, I'm sorry. Children do tend to do well with illnesses like flu, chickenpox, those type things, because children have really normally strong, healthy immune systems unless they have underlying conditions. And if you think of what children are exposed to every day playing in the dirt, you know, they tend to be able to fight infections off well. So their immune systems are good. But like the people that we vaccinate that are 65 and above, we strongly encourage that they continue to mask, they continue to do the social distancing, the hand washing, because with age, your immune system does not work well. And most people 65 and older have what we call comorbidities, other illnesses. So there's no vaccine that's 100% effective, but I can tell you that the individuals we've dealt with that have had the vaccine, unless they have had significant underlying health issues, it has been milder. The symptoms have been milder. The one reason the CDC recommended the wearing the mask, again, if you are vaccinated, is that I can walk around with COVID and not really notice the symptoms and be spreading it because I'm vaccinated, the symptoms are milder. So that's one reason. I know that guidance has been very confusing, and I promise you it's been very confusing to us because we've had to change our message. That was one way, that was how I got my 16-year-old son to get vaccinated. I said, hey, you don't have to wear the mask anymore. Now he has to wear the mask. So it has been a hard message, even for us in public health, to wrap our heads around. The guidance does change frequently. This Delta variant is making people so much sicker. And, you know, we're at 14 deaths, so our goal is to not have any more deaths. And we definitely do not want to see the children suffer from this variant this year. But, you know, we will support the nurses at the health department that are available. I'm on call 24/7. Whatever it takes to keep the school doors open, keep the staff and the children healthy, we'll support you any way we can.
Ms. Booth, will you real quickly talk about, we've talked about this, about the children getting the vaccine, and then the media putting out there that, you know, there was a very small amount that were getting information around March. And then we talked about if they got the COVID.
Yes, so, the myocarditis, I think is the one, yeah, so, which is the swelling around the heart line, is a side effect also of the COVID virus. So, the myocarditis that they're seeing in a very minute amount with the vaccine with children is still, again, a smaller percentage than it is with the actual COVID virus itself. So, because you have to remember, your immune system is responding to what it thinks is COVID. You know, so whether that's the actual virus or whether that's the vaccine, your response is going to be what it's going to be because it's your immune system personally. They have also seen the Guillain-Barré syndrome, which is also a side effect of your flu vaccine. Again, that is an immune response, and that's what your immune system would have done with that vaccine regardless. The way that the J&J vaccine was developed is very similar to the flu vaccine, correct? So that response, that Guillain-Barré syndrome, is exactly the same response that a flu vaccine would have given that individual. It just depends on how their immune system responds. The myocarditis is a side effect of the COVID virus. And it's also a side effect of the COVID vaccine in a smaller percentage. So the media loves to just explode on different things, and especially with a new vaccine. And yes, myocarditis has been seen in children. It's also been seen in children infected with COVID.
And it's also seen in children just in the general population without the vaccine. So a couple of studies that we've looked at said if you looked at this many children that were not vaccinated, you would more than likely see that small percentage of myocarditis in those children also. So the reason we're hearing about these side effects are we are monitoring the vaccines very closely. If someone has any adverse event with a vaccine, that they report to the health department, whoever vaccinated them, whether it be the clinic, Walgreens, if they report any reactions, and especially reactions that require a medical visit to a provider, we fill out a form that's called a VAERS form, and we do this with all vaccines, flu vaccines, chickenpox. We've done it since I've been in the health department for 26 years. So that vaccine report documents when they received the vaccine, what type of vaccine they received, and the reactions that they had immediately following the vaccination. That goes to the CDC. All that information is gathered, so you can look at information on all vaccines. But it's a great reporting system, and it has identified, I don't know if anyone in here remembers the swine flu vaccine that caused some serious side effects and deaths. That was how that was identified, that it was the vaccine, was through that reporting system. So that's why you're hearing the information. It's being monitored very closely, which is what we want to happen with vaccines.
Thank you, Ms. Booth. And I didn't get your last name.
Eller, Marita Eller.
Oh, thank you, Ms. Eller.
And if you guys run into any questions when you leave or you think of something, just give us a call or email us either one, and we'd be happy to help you out.
Thank
All right?
you. Appreciate it.
You're welcome. You guys have a great day.
policy. Ms. Knight?
So, yes, you heard what the health department is waiting on. In front of you, you have we did a survey with the parents in the community. So if you look at the top, actually there's staff and one of the parent. Let's start with the parent one. So the first page of that, you will see the spread of who participated, what grade their students were in, and it could be their child, grandchild. They could just be a random person that picked the fictitious child because they wanted to respond. But we had 563 responses. On the second page, you will see the graph that looks at the total responses and the percentages. And the choices were, one, all students and staff should wear a mask indoors at all times. Two, all unvaccinated students and unvaccinated staff should wear a mask indoors at all times. The third one was all unvaccinated students and unvaccinated staff should wear a mask indoors when proper social distancing cannot be maintained. And then the fourth was masks for students and staff should be optional, and families, they have the choice whether or not their child wears masks. The majority of votes at 88.8% with this parent survey was for optional masks. The parents needed the choice. So following this page, you will find several pages of comments. I will agree they were very varied. From America is freedom to let kids be kids to absolutely everybody needs to wear a mask. So very varied, but by and large, 88.8% of the people that responded to the survey were in support of optional masks. The second set of data that you have and graphs are from the staff. That was an internal survey that was done. There was 187 responses. We have approximately 230 staff. So that is a big majority of them. On the front page, you can see the spread that pretty well each school was represented fairly equally. The second page, you will see the graph. And they had the same choices as the parent survey that I just read to you. About 6% of the staff felt like they should, that all staff should wear a mask at all times. About 7% felt like all unvaccinated students and unvaccinated staff should wear a mask indoors at all times. 9.7% of the staff thought that all unvaccinated students and staff should wear masks indoors when social distancing cannot be achieved, and 77.3% of staff voted for optional masks. So that's the explanation of that graph. Following that, there's several pages of comments made by staff that you're welcome to look at. I just wanted to give you that additional information when you look at what choice that you make today, so that you can have that information going forward. Whatever you choose today, we will probably need to do something in the form of a resolution so that we can have information available to start school with. And if there's any other discussion y'all need to have, any questions about staff survey?
I just appreciate we put this parent survey and teacher survey out.
ML, board policies.
And ML and I think that's, do we need to go ahead and make a decision about the policy at this point?
You do, unless you're gonna meet again before.
I would prefer that we go ahead and make a decision today so that we can go forward with our policies and really train staff.
And I would just add, what you're doing is, as of this day, as of this time, at this time, the board is making this regulation. It's not a policy that's in concrete, we review it, change it, maybe in 5 years or something, 3 years. As of this day, at this time, this is what you're doing. All schools, I called Angie this morning about HELL is broken out in all the counties, all the board meetings, Wake County today. And they had thousands of signatures for mask in school, thousands of signatures no mask, thousands of signatures that it should be optional. So just know all the boards. One of the counties has voted, was it, or Asheville City voted there will be masks.
Jackson County.
Okay.
Jackson County.
There's Henderson County, their board just voted yesterday that masks are optional except on the school bus. So there's just a wide variety. So what you need to do today is have a regulation in place about face coverings.
Okay, so
Whether you're going to, face coverings were required in school by Executive Order 220, but Executive Order 224, issued July 29, 2021, says, as well as the CDC's recommendations, as well as Strong Schools Institute toolkit, state that school leaders should require all students, staff, and visitors, regardless of vaccination status. However, it should require, so they're leaving it up to individual boards, and that's why you see it in regular.
I know this is gonna be a huge decision for us, no matter which way we go. Ms. Wash and Mr. Madsen. And I know if we go with the option, and we have some kids wearing a mask, and some kids not wearing a mask, you may have to deal with the issue of, some kids, I don't know.
And I don't know if we will or not, because I mean, I think everybody's sort of used to either you're gonna wear it or you're not gonna wear it. We've not seen a lot of issues with kids.
I think we have it in elementary. We didn't have any issues last year of our kids wearing masks. We had no spread at the middle school. My concern in enforcing it is if I want my child to wear a mask, how does the school know that? Because when I get among my peers, I'm not gonna wear my mask. So are we gonna have parents complete something, or are we gonna have to be responsible for making sure that my kid wears a mask because I want them to, when you don't want your kid to? So enforcement is my concern.
It would be very difficult for the schools to be in charge of who wears a mask and who doesn't.
Oh, I know.
It's impossible to enforce that, so really that's gonna have to be back between the parent and the child. I mean, they can let us know, I mean, but I don't feel like teachers often have to make that child wear that mask. I mean, maybe one time if the parent calls and says, my child wearing it, I'd be fine for the teacher to respond to that, but we can't, I don't feel like it should be on, if we're gonna make, if the decision would be optional mask, it cannot be up to the teachers to have to make the child wear the mask that the parent wants them to.
Well, I'm not really saying that. I guess I'm more or less saying about what. For
Okay,
kids
so,
to see, it's like, why are you wearing that mask?
Well, I have it in, my recommendation is that you make it very clear when you adopt the resolution that any harassment, discrimination, bullying, or intimidation based on any person's decision to wear or not to wear a face covering will not be tolerated, and we can make that stronger.
That will go both ways, I'll tell you honestly. You know, there's some people that said they're gonna wear a mask no matter where they are, and I respect that, but they also are gonna criticize someone for not having one, whether it's a teacher, the principal, or another student, so that goes both ways.
And I think when you meet with your students, you'll make that.
We will, in our beginning of year meetings, we meet with every student the first day, and we will definitely address that. And honestly, the option is gonna create less trouble than having to try to get kids to keep them all the time. Because that was a constant battle all year.
Keeping them clean.
Yeah.
And I'm very passionate about it, and I do not have a problem that people choose not to wear masks, that's fine. I don't wear one in some situations, but it's a situation that's very personal to me. I have a daughter who's been laying on a gurney for over 24 hours because she can't get a room in a hospital because they had 21,000 cases of COVID last week.
And the cancer hospital has had to give up 2 floors for COVID patients. So it's very personal to me that, you know, the fact that other people choose not to wear one, I'm fine with that, but I probably will wear one in a group. So,
And I think that we need to make it very clear that it's a personal decision and we would treat it like we would any other bullying issue.
yes.
Board, we need to make a resolution, and I need to know your opinion or your will for this mandate. Jonathan, I'll start with you.
My opinion would be parents' choice. I would go to zero tolerance, like Ms. Ellen said, no bullying. I mean, zero tolerance with the bullying. Vice versa, if you are wearing or not. Bullying, it needs, you know, to happen.
That's out, yeah.
So I go parents' choice.
Mr. Garland?
I agree too. At this point, at this time, like Alan said, or Ms. Ellen said, I would put the option.
It's not.
I would also vote to be optional with what Ms. Ellen said, they've said about, you know, kind of making sure that we not make this a factory thing, but whatever. But definitely optional.
Okay, so what I'm hearing, we will approve the resolution that this will be parent optional. If the parents want the kids to wear masks, then they may, and if they do not, then they don't have to.
For students and staff.
For students and staff. Excuse me.
Anyone in here to go there. Yes, now, are we still going to do, we're still doing temperatures, right?
No, we haven't been doing that.
Each teacher has their own temperature checker, and I'm taking the walkthroughs up, and they don't tell me different. I mean, if we're gonna get back to normal, that's.
Well, so the CDC has nothing to ask to do that, so
Okay.
that.
It's like kids, it's mental
I think when we get back to normal.
So now I need a motion.
Yeah, and I just want to weigh in and to say that, and I'm certainly fine if wherever the board is, and I'm fine, and, you know, I don't have a decision, but I think optional, if I have one, it will be optional. But just what they said, the zero tolerance on bullying, and to keep in mind that this could be on buses, or is that how you feel like on buses as well? Because that has been very strict in the past on the bus. Optional on the bus. And then that, just to make it very clear that if situation changes and we see a lot of spread beyond what we can keep the doors open, because I think that's very important. Or in the county, if it were to be, if the health department, you know, were to, because we talk nearly daily, but, you know, if we were to see a certain rise, and that is a recommendation, I'd like for you to consider that when we come back together to look at, you know, we need to do something else, and, you know, in the well-being of the community, but right now, I would support.
I would like to see them encourage families to still sit together on buses. You know what I mean? Not necessarily, you know, you come within a family, that's what we did last year. If those children will sit down on a bus, that seat is high enough, that is there. Once they get people sitting
We
down.
tried to stick the same protocols last year, as far as bus transportation, not transferring buses, and which we help.
Yes.
But I've got a couple of things too, with it. We're not gonna, you know, as far as masks, we're not gonna supply masks, because that's, if you're even gonna do it, if it's an option, I think parents should supply masks if they're gonna do it. We do it, but it needs to
On
be,
the mask that they want through child.
right, because it's going to be disposable, if not, to be really sanitary, and that could be a lot of money. Number two, when it comes to bullying, if anything comes to y'all as far as bullying is concerned, it's like any other issue, we can't deal with it if we don't know about it, and bullying uses a buzzword after the fact, after a fight or something. So anytime you hear something like that, we always address it if we know about it. So I just want to keep that in mind too, that we can't deal with it if we don't know. So if somebody comes to y'all, always just, you know, so that's hey, you told somebody or somebody know about it. So we won't tolerate it either way. So that's my point.
Can I say too, in our beginning of year meetings, we will stress the kids that if they are bullied because of the mask situation or any reason, you know, they need to come forward immediately. Because when they put it on, they go home, they tell the parents, and the parents call in, it's really hard for us to go back and prove that anything happened unless there's numerous witnesses and things like that. And usually in a bullying situation, there are not witnesses. So It's something that we will stress with kids that they, come forward immediately.
I think your resolution includes that the employees and students engage in the preventative strategies that you've utilized all along anyway.
We still want to be,
You're gonna wash hands.
wash hands, and that's just good. Anyway, we started doing that.
I read
We had to remind people to wash their hands.
that your employees still engage in the preventative measures, while face coverings become optional for employees and students, that they still engage in preventative measures. And grouping, you wouldn't want 5 children just right here in this little corner. But just engaging all their preventative measures would be considered washing of hands.
In your board packet, there is a sample resolution, if you want to look at it.
And you might only have 1 page.
Oh, I'm sorry, I guess it was.
Because it's
So, there's a 2-page one somewhere. Have you got 2 pages?
Well, I've got 2.
Does everybody got 2 pages on there?
I do.
I got 1 page as well, so I guess it's a least one. So, I can. Have you got yours? Mr. Nelson?
You want
The resolution in there?
what's it look?
It's this.
No, I didn't have that for some reason.
It's in there.
Mr. Moody, we of course will provide plenty of cleaning supplies for the teachers.
Yes,
And I think
we'll keep the hand sanitizer stations up and running all over the school.
I think that's key to keep things wiped down in the classroom and between classes, between students, on desks.
We're going to encourage, dedicated distancing as much as we can. We're going to redo the auditorium with desks in the middle to help us spread out more with the bigger classes. So it's still going to be the same thing. It's just
We're encouraging some classes to go outside. I mean, that's just good anyway, to get some good fresh air. So we're adding some outdoor classroom spaces, and that's part of even some of our ESSER funding that we got. We figured that in to that. Additional cleaning supplies are part of that. It's not any kind of PPE that we still would need, if we need gloves or whatever. That's all part of the COVID funding, so. So if you so choose, you could adopt the resolution, correct? I'll be glad to read that out for everybody can.
You want me to read it?
I don't care to read it, it's fine. So, this was a sample that's provided, and, it says, whereas, as of this date, Graham County is rated, to have a, 10% rate, 10% rate of COVID-19 community spread according to the Graham County Health Department. The alert system developed by the North Carolina Department of Health and Human Services, which evaluates the county's COVID-19 county case counts, percent positives and hospital occupancy. And whereas the requirement that mandatory face coverings are required indoors and on school campuses was rescinded by the expiration of Executive Order of the Governor of North Carolina, number 220, effective July 30th, 2021. And whereas the requirement to wear face coverings is only one of many preventative strategies that is employed by the Graham County Board of Education to prevent the spread of COVID-19. And whereas pursuant to North Carolina Executive Order number 224 issued July 29, 2021, and commencing August 1, 2021, in accordance with CDC's recommendations and as recommended in the Strong Schools NC Public Health Toolkit, leaders in all public and non-public schools should require all students, school staff, and visitors, regardless of vaccination status, to wear face coverings at all K-12 schools unless the face covering exception applies or medical or developmental conditions prohibit use. Whereas the CDC directs the localities to make decisions on COVID-19 prevention efforts in light of local conditions. And whereas the Graham County Board of Education is consulting frequently and working closely with Beth Booth, who is the Graham County Health Department Director. And whereas Superintendent of Graham County Schools has taken a poll of parents and employees regarding the use of face coverings in school in order to assist the board in making an initial decision about face coverings at the commencement of school year 2021-22. And whereas promoting in-person learning and focusing the attention of educators on instruction are critical to the education and health of children of Graham County. And whereas, given the current obstacles of distinguishing between vaccinated and unvaccinated students and staff, it is the board's position that all students and all employees are particularly sensitive to the needs of others in their presence, and said students and employees shall take the requisite steps, including wearing face coverings if the situation requires close proximity and working together. And whereas the Graham County Board of Education, upon review of all available information and in constant communication with the Graham County Health Department, shall at this time leave face coverings to the decision of employees and parents. And whereas while face coverings are optional at this time commencing August 3rd, 2021, it is the purview of the board to revise the procedures for employees and students as the situation of COVID-19 requires. Now therefore be it resolved at this time, the Graham County Board of Education has no individual face covering mandate for employees and students. Failure to wear face coverings on property of the Graham County Board of Education or at school of the Graham County School System will not be considered a violation of board policy or school rules. All students, employees, and community members are encouraged to make their own decisions respecting their personal health and the health of others in choosing whether to wear face coverings. Any harassment, discrimination, bullying, or intimidation based on a person's decision to wear or not wear a face covering will not be tolerated. Now therefore be it resolved by the Graham County Board of Education that this resolution be adopted. So that was the sample policy if you choose to.
All right, now, all I'm gonna do is make a motion, that I have a motion to accept this resolution.
With one revision, okay, on page 1, which is the third whereas the prior requirement to wear face coverings, you just need to add the word prior, whereas the prior requirement to wear face coverings is only one of many preventative strategies.
So that would then read, whereas the prior requirement.
Well, yes, it starts off how things work, so let's go ahead. No, strike prior, never mind, strike prior, it's good as it is.
Okay,
It's good as it is.
all right.
One of the concern I had the last time we met, and maybe Mr. Madison, and especially Ms. Walsh, when they have, if another school system has adopted to wear face coverings, they feel like that their rate of COVID cases is up high enough. And they come to our school versus if we go to their school. Are we going to be required to wear face coverings if we go to their school? And if they think that their rate is high enough in their school and they have adopted face coverings, if they come on our campus, this is my personal feeling, I think they should wear face coverings.
Is there anything with the high school athletic association that's been got that? I don't know, that was a question we had over.
There is no guidance in the high school athletic association right now on that. There is not.
How do y'all?
I can tell you, I don't know how we could enforce making someone put a mask on when they come into our building. I mean, I don't know if you attended any basketball games and all that. Like it was, they might wear it when they came in. They didn't keep them on, and it was very hard to enforce that. How strict they will be when we travel to schools that are requiring that. I can't answer that, but that's their school policy, and whatever their school policy is, I would feel like if we're a visitor there, we should adhere to what they're asking us to do. But if our policy is they don't have to wear a mask, then I don't think we should force anyone to put one on. That's my opinion as the principal of the high school.
I was mostly not thinking about it necessarily as much. I was thinking more about sports things.
Yeah.
With our kids being close together because they're probably.
I know the mask mandate by the High School Athletic Association during athletic events is lifted. I mean, they do not have to wear a mask during competition now, so.
They're going, okay, they don't.
No.
Okay, they're going, because people coming from other counties are going to sit together anyway.
Yeah.
And also, we did have a scrimmage last week, and there were several teams involved, and they did have one student on the team from not Mountain Heritage, one of those teams, and they pulled out because they did not want to expose everybody. So I think a lot of that's just going to be, an honor system.
Self-control. All right, do I have a motion to accept the resolution making face coverings optional under Graham County Board of Education policy and school regulations as presented? We have a motion, do I have a second?
Second.
All in favor? Any opposed? Okay, so we are now optional. Okay. All right, now, Ms. Davis. Board policies. I can find them.
Here's the manila folder. And I put a copy of the policy changes that have been, that's the top sheet. Okay, 3610 is the counseling program. That is essentially rewritten. When you look at that, every paragraph is revised from our old policy. And it now comports with the new mental health initiative that you all adopted in the June 21st. So as you read through that, involvement of parents and others, provisions of counseling services, academic advising, it's all completely revised. So, and we'll be current with the mental health initiative. Criminal behavior. It is not substantially revised, but it changes where you send your reports of criminal behavior, which is significant. Instead of the State Board of Education, as of March 31st of this year, we sent it to our criminal report to the Department of Public Instruction. So that is substantial. If you'll go to B on this policy, reporting criminal behavior, it comes from the North Carolina School Board Association as principals must immediately report to law enforcement. We've always done superintendents because your superintendent is who has a finger on the pulse. And you may have a crime in the middle school, you may have a crime in high school, and you go through to the superintendent. So I've always revised that instead of saying principals report to law enforcement, the superintendent reports. And there's 10 acts. The rest you all can deal with, but those 10 particular acts of crime that are listed in B must go to law enforcement. Okay. Use of student transportation services. The changes in here, again, are from March of 2021. And the reason is that the State Board of Education kept saying state-operated buses. It's yellow bus. So at the university in North Carolina, there's yellow bus versus activity bus. So the changes that occurred there are clarifications of what's meant by state-operated vehicles. So that's in A. That's in A. And then special use, and you all have a special use exception, it's to cover that. Policy 7241 is drug and alcohol testing of commercial motor vehicle operators. And this had a fair number of changes. And the reason is it's just to comply with all the federal updates to what's referred to as safety-sensitive positions. And if you go to B, the prohibited acts, there's clarifications there and additions. And if you go to B5, Schedule 1, drugs, they've added CBD except because it's become very popular for medicinal purposes. However, the issue with B5 is that a Pedialex is an authorized authorized medication. And it has a heavy base of CBD oil in it. So you're going to have a bus driver test positive for THC if they're on a Pedialyte. So you need to be very careful when you do testing now with your CBD, because CBD oils making their way into some pharmaceuticals.
What is THC?
Pedialex, EPIDIOLEX.
Should we have the bus drivers to tell us if they are on this?
Well, when they have their drug testing, they list any kind of.
Oh, okay, okay.
But it's mostly, the board just needs to be really careful, and that's what this does, before taking any action because of the amount of CBD oils that are making their way into pharmaceuticals. Then, number D2, the school system can register with the commercial driver's licensed drug and alcohol clearinghouse. And you can do an annual inquiry through the clearinghouse. And I'll provide, approve this policy, I'll provide the contact of where to register your school system with the clearinghouse. And then training and education, there really weren't any changes there. I just comment on that. Not only is your bus driver having to have training materials with principals and assistant principals, you need to be provided the same education materials that you utilize with your driver. Then 7410, teacher contracts. The one you have in front of you, is, let's start with, you have a current policy in teacher contracts. The State Board of Education now allows you to, the board at the time you adopted your policy in teacher contracts, 4 options. I want you to look at, it's just being revised again, but I want you to look at your current policy, and that's what you have. I didn't repeat the 4 options that the State Board of Ed has authorized, because you spent a lot of time on this policy and came up with steps and procedures that are in it. There's nothing that changed under the 4 options. What's changed is that if you go to C, there's a definition of, before you select your option, of what a full-time permanent position is. And the teacher in a full-time permanent position did not work for at least 120 work days. As a teacher in a year for any reason, then that's not a year. And we have that in our current policy. We have that this time. So I didn't burden you with all the options again, but I think it's important that you look at it and make sure and ask questions of your superintendent that that's the option you would continue. And 75.
So Ms. Knoll has a question about, is this adjunct facility, or the physical therapy as faculty? Yeah, so it's adjunct teacher, so it'll be the same thing like if we need someone to come in, and Charlie and I had a conversation about this just recently, that the state board is in the process of approving someone to do, like, if we need someone to teach one class of a French class,
Okay.
or, an art class, then we would be able to contact that person for that one class, and they wouldn't have to have a full contract. They could just come in for that class, and just pay for that class. They still have to have certain credentials to, and the state is in the process of saving those. It's just kind of like that. It wouldn't be like, I was an adjunct professor for Tri-County Crimes type thing, just get on and teach certain classes.
Do they have to get them? Is that something that you can see?
I'm sure it might be. process all the way through. That is one of the current things, and really have no place to expand our curriculum.
And they're gonna provide the money.
That what we haven't heard. Probably not.
You know, so many schools have had to eliminate arts and.
That's the key.
Probably the mandate.
Okay.
On your lead, on 7510, that's lead. If you go to paragraph 2, that's the contact information to comply with the State Board of Education lead policies. Other change in this, there's nothing substantial, it's just temporary requirement related to COVID-19. And it gives a definition there. The COVID-19, what it is, and it's remaining in effect as long as the state guidelines remain in effect.
Just for your information, we no longer have, I mean, and I'm sure it's in here because we could come back at some point, but at this point, we don't have any hours allocated for COVID leave as a state employee got ran out already. We have had that allocated in the past, I think it was 80 hours. And they could at some point reduce that, but, I mean, COVID, this is saying to me that COVID is an acceptable reason to be out, but we don't actually have COVID leave.
In other words, if they have quarantine for 14 days,
They're on days.
it comes off their sick days.
That would be great.
And this policy said, I mean, it doesn't give any leave for COVID, it just says when an employee tests positive, they have to meet the criteria of the North Carolina Health and Human Services before returning. This doesn't give leave for COVID. It's just saying you can't use your own policies about when to bring back COVID. You have to use this one with the North Carolina Department of Health and Human Services. When to allow COVID employees.
I know that's bad, but make quarantine, but people come to school with the flu, and they come to school with the flu.
Is that something, I'm sorry.
I'm just saying, they'll come to school with the flu, but.
Right.
Right.
We're gonna keep our same policies. Last year though, if the teachers quarantined after 3 to 5 days, and they test and come back, so keep them out 14 days, because that's what got us in the gym last year. As
Do
far
we
as,
need to?
as far as shutting
And
schools
see, we
down.
can't change, I mean, we can't change what this says, this is state policy, so we can't override that. But I think that what you're talking about, that's the situation where we can continue to work with the board.
That's how we got shut down last time.
Is that what we're gonna, is that what we're gonna do this year?
Well, we're gonna have to talk about that and make sure we're consistent before we.
Okay, I just wondered, I mean, because quarantine's what how we shut down.
We were, our staff was designated as essential staff, so that we were able to bring them back a little quicker. And I think that we need to try to do that as well again this year. That'd be my recommendation, Mr. Rick, so we continue what we're doing.
At the end of the year, we were doing that with students also.
Yeah, so that's.
If they were just quarantining, you know.
Yeah,
So we can't quarantine, that has to be the health department, is that not correct?
well, yeah, so they can't make, they can make, the health department recommends. They can't make anybody do anything, they have no authority to do that. We have more authority than they do with our policies to say, well, you have to be out 14 days. So, and I think it's all situational, depends on if you're around an active case versus if you're just around somebody that has no symptoms. And that always, I mean, we work with them from every day, make sure that we're complying with that consistently.
And we don't have any more remote.
No, there will be no remote options.
And I said 99% of people we quarantined last year did not end up with the virus.
Right.
So now, again, that may change with health, so, but I just,
Right.
I'm on the side.
So we want kids and students and staff to be back as soon as they can. So we'll try our best with that.
Okay, just, Myra talked about policy 3225, that's what I'm going to list here. Technology responsible use policy. We're just going to get more organized. When it's not on my list, I just change out dates and approval and that kind of thing. So we'll just start doing that on my list, but it'll come back because you approved today, 8-3, so it won't be on your second reading. the same thing with the Title I parent document. But I'll just start putting on the list. Those are reaffirmation. They're not changing, they're just reaffirmation. So, and another one is the use of school buses across to travel. And we'll start putting that on. That's just for clarification for you all and for correct dates in your plans.
Most federal programs have things that have to have an annual report.
Reaffirmation. Yeah. And so you'll have correct dates in your policy. I know you all have three. Thank you.
All right. Do I have a motion to go into closed session?
Pursuant to the provisions of North Carolina General Statute 143-318.11, parentheses A, parentheses 3, and 143-318.11, parentheses C, I move that the Graham County Board of Education go into closed session to receive advice from Ms. Ellen Davis, attorney for Graham County School Board, which advice comes within the purview of the attorney-client privilege. This advice will be general legal advice about legal issues or legal matters. Pursuant to the provision of North Carolina General Statute 143-318.11, parentheses C, I move that the Graham County Board of Education go into closed session for the purpose of considering personnel matters as defined in and allowed by North Carolina General Statute 143-318.11, parentheses A, parentheses 6, and North Carolina General Statute 115C-321.
Do I have a second?
Second.
All in favor? Any opposed? We're going to closed session. We're ready. All right. Action items, Ms. Knight.
Yes, I recommend that you approve Samantha Guthrie as a child nutrition substitute.
Do I hear a motion to approve Samantha Guthrie as a substitute in the cafeteria? Do I have a second?
Second.
All in favor? Any opposed? Okay.
I recommend that you approve Adam Brooks as the middle school baseball coach.
Do I have a motion to approve Adam Brooks as the RMS baseball coach?
Approved.
Do I have a second?
Second.
All in favor? Any opposed? Okay.
I recommend that you approve the list of volunteers as presented.
Do I have a motion to approve the volunteers that were presented to us?
Approved.
Do I have a second?
Second.
All in favor? Any opposed? Okay.
I recommend that you approve the list of bus drivers as presented.
Do I have a motion to approve the bus drivers that were presented?
Approved.
Do I have a second?
Second.
All in favor? Any opposed? Okay.
I recommend that you approve the fall sports staff as presented.
Do I have a motion to approve the fall sports staff as presented? Do I have a second?
Second.
All in favor? Any opposed? All right. Any announcements?
Our next board meeting will be a regularly scheduled meeting on September 7th at 10 a.m.
Okay. Do I have a motion to adjourn?
So moved.
Do I have a second? All in favor? We are now adjourned. Thank you very much.